Okay, with the help of Sim Mom here, she's kind of taken apart, but it's for me to help show what goes on in some obstetrical emergencies that we're going to talk about. The first thing, emergency we're going to talk about is a prolapsed cord. It's most likely to occur with rupture of membranes, so that's one of the reasons that the first thing we do once mom's membranes rupture is check the fetal heart rate, because we're wanting to rule out a prolapsed cord. It can prolapse without coming outside of the vagina where we can actually see it. So how do we determine if it's prolapsed is checking the fetal heart rate, which I'll talk a little bit more about in just a second. So what happens, I will say mom obviously is taken apart here, but I want you to picture the fetus here being enclosed inside mom's uterus. So here's her cervix. If from inside, this is the cervical opening, and then just picture the wall of the uterus surrounding the baby. So here is a smaller version, cervical opening and the uterus. So again, remember the baby's not just floating around with mom's internal organs, it's actually inside the uterine wall. So the reason it most likely occurs with rupture of membranes is if baby is not engaged and it's floating in its amniotic fluid up here, and then all of a sudden mom's membranes rupture, the change in the pressure from the water coming out tends to bring baby down a little bit more. But if the cord comes down first, before the presenting part, which is hopefully the head, then that is a prolapsed cord. So the cord comes down before the presenting part of the baby. Now, it can be as drastic as prolapsed as outside of mom's vagina. That's an obvious one. It can be prolapsed as well and not be able to see it hanging out. And a lot of times we'll know that it's prolapsed because of the fetal heart rate. So we check the fetal heart rate. If baby's head is still not engaged, the fetal heart rate may be normal until mom has a contraction, and then that contraction pushes the baby or the presenting part up against the cord, okay? And then when she stops contracting, it releases that pressure, so the heart rate goes back to normal. Now we know fetal heart rate decels that are caused from cord compression are called variable decels. So if we see reoccurring variable decels with contractions, we may suspect a prolapsed cord. Now, if the baby's head is engaged and there's constant pressure, not just with contractions, but if there's constant pressure on that umbilical cord, it's getting compressed continuously, then we will see a prolonged fetal heart rate decel. So the monitor here, this would be if baby is not engaged, mom starts having a contraction, there's cord compression. You see the variable decelerations here. Here is a prolonged decel. So if baby's engaged and there's constant pressure on that prolapsed cord, you'll see a prolonged fetal heart rate decel. So what do we do about it? Well, once the cord is prolapsed, there's obviously call for help. Because you're not going to take care of this alone. This is an emergency situation. The baby's going to come out via emergency C-section. Now, so call for help, number one. Number two, a lot of times it's found upon cervical exam. Now, obviously this is a mannequin, so I don't have gloves on and whatnot, but if we find it upon cervical exam, okay, don't press on the cord, because if we press on the cord, we know it's going to cause decelerations. That's what we don't want. We want to press on the presenting part. If we press our fingers on the presenting part and relieve that pressure off of the cord, then the fetal heart rate's going to be normal until the baby's born by a cesarean section. Okay? Other things you can do to help, now you don't want to release this, so once you're here, you're staying until the baby's born, okay? But other things that can be done to help is mom's positioning, okay? So if we put her in Trendelenburg, gravity's going to work in our favor, okay? We'll pretend she's actually in Trendelenburg, and hopefully lift that fetal head a little bit off of that cord. Knee chest could do the same thing. Having mom's head lower than her pelvic region, gravity can help work in our favor. Now, other things, we're going to be other people, we're going to be telling other people what to do as far as how to prep mom for cesarean section at this point. So informed consent, IV fluids, lab values, call anesthesia, call doctor, and rush her to the operating room.